Hello and welcome. I'm Stefan Chrisel, one of the acupuncturists with the Chanda Center for Health. Happy to have you watching today. Wanted to also mention that I did a talk last week as well for the Chanda Center, talking about a variety of strategies for helping manage our immune system, respiratory support, and stress and anxiety management. And the primary focus for that was nutrition, although we touched on a few other things. Today, I'm going to be focusing more on the use of acupressure, self-acupressure, as a tool for some of those same goals. I will be continuing to have these discussions the next couple Wednesdays. So next week, I will be talking about some additional strategies and reinforcing some of the things that I spoke about at the first discussion. And then the fourth one, we'll be doing some additional acupressure work. So again, today we're going to focus mostly on immune system, respiratory support, and stress and anxiety management. A few things I want to mention before we get started is just to highlight the history of traditional Chinese medicine in treating acute illnesses and managing those. Much of early traditional Chinese medicine written record is around treating and addressing epidemic diseases. There is a lot of information there that I think we can certainly use today and be applicable. Acupuncture has been defined through a variety of research methods as primarily having an effect on both our nervous system and our endocrine or hormonal system. And those being the two main regulators can really support a lot of different functions within our system and help things function a little bit better. The last thing I want to note along those lines is the connection between the gut and the immune system, which is really clearly delineated in traditional Chinese medicine, and there's been more and more research about the role of the gut biome and how much that influences the immune system, and that in fact many of the cells that are responsible for immune system function are basically produced through the gut system. And so we'll be touching upon that more, but the interaction between the earth really being the nurturer of the immune system. So our digestive system really helps support that. So acupressure versus acupuncture. So I use this pretty consistently in my practice as an adjunct to acupuncture. And for some people who the needling they're a little too sensitive to the needling or prefer not to, it can be a really helpful, appropriate tool. It is not as strong and as a lasting stimuli as a needle treatment might be. So I think one of the main things is in order to have the effects, it's good to work on this on a somewhat consistent basis to kind of help keep that effect going. And so I've had many people be able to report that by doing acupressure consistently between treatments, it helped them maintain and sustain the benefits of their initial treatment that much longer, which is always a good thing. So there's something about the consistency of actually doing it and the physiologic response, and also the physical emotional connection of like the conditioning of like you kind of do this and have had this response in the past, and it kind of reinforces that over time. So it's about ritual, which is something that we use in a lot of different ways. We have rituals in our daily routine, and being able to make this somewhat of a ritual for you gives you a tool to work around with some organization and can give us a sense of control. There's a lot going on around us right now that we don't have a lot of control of. And so this is something hands-on that can help us get in touch with our body and also give us some good support along the way. So setting can be really helpful. So if we're trying to do some of this as proactive work and we're in a situation where we can, it's ideal to be in a nice quiet environment to start to kind of really settle into our bodies even before we get started. So some of the other talks that have been presented by Chanda, the breathing techniques are a great one. Even if you're not doing a specific technique, just kind of connecting with your breathing, getting into a little deeper breathing, really trying to breathe from the diaphragm so that you're getting some movement of the abdomen as well as you're breathing in and out so that you're getting full breath. And that's really important. One of the things when we're stressed, other factors is we can really restrict our respiratory cavity in space, which has obvious detrimental effects on our breathing capability, and over time can certainly have detrimental effects on the functioning of our immune system. I think the most important thing when you're doing this is to try to really be present in the moment, be focused on that. Obviously, there's some situations, especially if you're experiencing acute stress, etc., you might not be able to kind of create that environment, and it's still going to be helpful. So when you're trying to respond to something in the moment, do the best you can in those moments where you have the ability and the time to be able to sit quietly for a little bit and really kind of focus on your body and what you're doing. It's going to just help reinforce the effect that much better. So of course there can be a concern for many people about their ability to do this independently based on their level of hand function or lack of hand function. And so I want to throw out a couple potential adaptations for that. And certainly I've always encouraged, when I've done acupressure classes in the past, I've encouraged people to attend with family, friend, caregiver, somebody that they can reciprocate with each other potentially, or if you're not able to do it, a caregiver that can potentially do some of this with you as well. And the nice thing about having this as a recording is that you can therefore return to that for reference if you're not quite sure, remembering exactly where a point is or a point that you want to use. This would be a great reference. I also have little index cards that have both pictures of the cards and a description of the card. So if anyone finds that would be additionally helpful, I'd be happy to send those to you. If you just, copies of those, if you just want to send me an email at the email address, which I think I mentioned before, but it's omstephen1@gmail.com. That's omstephen1@gmail.com. And you can certainly feel free to reach out with any questions or concerns related to this or with prior topics that I've talked about. Some of the other adaptations that you can use are, if you can't use fingers, can you use a tennis ball or some other small ball to rub into some of the points? There are some, I know some people use T-bars to access something where they can kind of grasp onto the bar and it has something to push. Really any kind of blunt object that you can kind of push on would be fine. There's several, several tools. This is one that I use a lot. And so it doesn't require, you can kind of grab it in a variety of ways if you have any grasp strength. And you have this nice little knob. You also have this backside here. And you can, again, just kind of use that to press into a point as needed. And lastly, for someone who wants to try and do it on their own, doesn't really have the ability to use their hands to do it, you can certainly use the edge of a rounded surface. So the edge of a chair, table, something like that, that's stable, that you can, if you have, for example, a power chair, and you can kind of position yourself against that and get that pressure into that spot. That would be another way to do that. And then, of course, working along with a friend, family, or caregiver. If anyone has other ideas of how they might be able to accomplish that, or would like to discuss more about their particular situation, I, of course, would be happy to try and problem solve that with you. So the points I'm going to go over today are not all inclusive, of course. I'm trying to focus on some of the primary points that are easy to access, relatively speaking, or at areas that are easier to find. So around some good anatomical landmarks, etc. I'll throw those out at you. You can work with them, and when I do this again in a couple of weeks, I can certainly add a little bit more stuff to it once you've had some work with these initial points. As far as how to stimulate the points, I think that in reviewing a lot of literature and through my own experience, I think it's really what works for the person. So some of the main techniques are just holding a point consistently. You can also do where you keep the pressure steady, but you do a little circle with your finger. And then the last one is tapping, where you just kind of gently tap on the point. The pressure should be firm, but not grinding in. So you want to get a little bit below the skin surface and hold that pressure. I typically recommend trying to do at least a minute. A couple minutes would be ideal, but if you're doing multiple points, if you can spend at least a minute at each of those points, that would be really helpful. And you can certainly do most of the points that I'll be talking about today on both sides of the body, which you can do, or you can, if you're doing it on a regular basis, you may do mostly points on one side of the body one time and one side of the other time. I personally find I like to most of the time do a little bit of time on each side of the body. So that's certainly something that I would encourage you to experiment a little bit with and find what you feel works best for you as far as just being able to do it and what really works for you. So we're going to start talking about some points, and I'm going to try and give a good description of how to find them and how to stimulate them. And then we'll kind of go through some of the functions of those points as well as we're doing that, of course. And like I said, I'm going to try and give you as many of the main points as we can, and then we'll kind of go from there. So I was going to start with a couple points on the chest. So I'll stand up here for a minute so you can see a little bit better. So I find the best way to find this is if we get right under our clavicle, collarbone, and we follow that all the way out to the shoulder. We'll get to a point where if we're just following along that line, we run into the deltoid muscle and the shoulder complex there, and we really can't go any further without going up and over. So we go right into that little notch there. And then what I usually recommend is trying to use a few fingers where you're just kind of holding that pressure in that area. So this is the first point on the lung meridian. It's really helpful for opening the chest. I'm going to talk about a couple points for that, which again is really important for two reasons. One, to keep good respiratory function. And when we have a lot of stress, it's one of the areas that a lot of us tend to hold, and we tend to get really restricted. Feel that pressure and heaviness in the chest. So I'm oftentimes encouraging people to do postural things, to really open up backwards and open up that chest. And this is a point that can really help reinforce that. And it also can be used to help address acute symptoms. So if we are already having some illness, a cold, other infection that's affecting our respiratory system, this would be a point that we would want to spend some time on. It's going to help with the symptoms, and it's also going to help support our immune system in dealing with that issue. The next point I wanted to focus on would be Ren or conception vessel 17. And this point is right on the sternum in the center of the chest. There's a couple ways to find it. I find the way that is most preferable is if you find the very tip of the bottom of the sternum, the xiphoid process, and then use about a hand width, and then just go right above there, right in the center of the chest there. This, again, is a really good point for opening up the chest. The idea of whether physically or emotionally getting things off your chest, really opening that up, improving breathing capacity, and also helping support that good immune system function. So another point that can be used, not necessarily to try to manage the stress, but to manage the physical effects of stress as they are impacting our system. Lastly, on the chest area is kidney 27. So if we have the sternal notch here, which is the little notch right in the center of our chest, it's going to be below that clavicle, and it's going to be a little bit lateral. So again, I find that one of the best ways to do that is if we, again, use that collarbone and come all the way until we start to feel the more cartilage that's on the borders of that little notch here. You can also get on that notch and use a couple fingers, 3 fingers, and kind of come over. And again, most of these points as you're working them, and I'll note the ones that don't, are going to be in a spot that's softer. So if you're on something really hard and not really giving, that's not going to be the ideal spot. And you're just going to want to move over a little bit. And you can actually do both of these at the same time, just like you can do lung 1 both at the same time. Some people like to do this. They feel like it's really reassuring and protective while they're doing it. And this is another point, really good for immune system function, and in particular helping support respiratory function. So lung 1, Ren 17 in the center of the chest, and kidney 27 would be 3 points directly in the lung chest area that can be really helpful to be used. I'm going to talk specifically about a couple additional lung points that can be helpful. So the next one is going to be lung 5. So if we get right in the elbow crease here, and if we're looking at our hand facing us upwards, so if we have that way, if we get right on the wrist crease and we find that tendon, biceps tendon right there, it's big ropey tendon, and if we just slide over onto the thumb side of that tendon, we are going to be in lung 5. And lung 5 is a really good point for helping us with cough. That's probably the premier point that I've used for dealing with cough when people are having an acute respiratory illness. And so that would be a really helpful point for there. So again, right on the inside of that biceps tendon, right on the wrist crease. Next point is going to be lung 7. So just to reinforce, all these points run more along the radial or thumb side of the arm. And lung 7, we get right proximal to the wrist, so just up from the wrist, there's a little bony prominence called the styloid process. If we find that point and then just slide off of it again into a softer spot in between a couple tendons, we'll be right on the spot. I realize as I'm talking about these spots, it's important, especially as you're first doing this, not to get overly concerned about, am I exactly on the right spot? I think the more you practice it and look for those soft spots, you'll feel more confidence with it. And a lot of times what I encourage at the beginning is trying to, sorry, I lost my track of thought there. Trying to use a few fingers to stimulate the point. So rather than just using one point, use a couple, like up here, and you're gonna certainly hit that area. So for this lung point, you can certainly then just hold that steady pressure. One thing I like to do is actually kind of like gently squeeze, almost pinch, but not really, but just kind of working that area. And that, again, can be really helpful for helping us deal with acute respiratory symptoms. Next, going to talk about lung 9. Lung 9 is going to be right at the wrist crease. Again, on the thumb side, I was going on the wrong side there. So lung 9, right at the wrist crease. So there's going to be one tendon all the way here, and we're going to be right inside of there. And again, on a soft spot. So if we go here, there's a tendon. If we go here, there's a lot of harder tissue, tendon, and right in that little spot right there. Lung 9 is actually more of a proactive point, typically used to help tonify the respiratory system, the immune system when there's a deficiency. So this would be something that would be great to use proactively right now to try and keep that system strong. And then on the lung channel, the last point I have is lung 10. Lung 10 is going to be right on the outside, outside of the thumb here. And it's going to be right in the middle. So if we're along this bone here, there is a little depression about halfway between the joint and the wrist. And you can just hold pressure there. A lot of times, people find it's easier and still helpful is to just rub back and forth along the length of that bone. And that point can be particularly helpful for any kind of throat issues. So it's used a lot for acute respiratory, but also for things like pharyngitis, laryngitis, etc. So it can be really good for helping clearing the throat, moving things through. It also has a helpful effect for if we're having some stomach issues along with some respiratory issues, this would be a point that could be helpful for that as well. And I think that's important to note because a significant amount of people, if they do catch the virus, are having both gut and respiratory issues. So this lung 10 point, again, would be a good point to consider for use. So as far as proactive points, the lung 1, lung 5 at the wrist crease, and lung 9 here would be the points that I would say would be best to be being used proactively. And then certainly adding the others into the mix if you were having any respiratory concerns. I'm going to talk about a couple large intestine points. So even though this is the large intestine meridian, it starts at the pointer finger and kind of comes up to the face and is used a lot paired with the lung to deal with respiratory immune issues. A lot of times can be used very locally for specific symptoms. I'm going to focus more on some of the general points. So one is large intestine 4. It's basically one of the more popular points used. And a way to find that is if we, oops, sorry. If we, here we go, we get the hand, if you can see the top of this, which is the web space. So if we just put our 2 fingers together like this, we're gonna raise that, sorry, I've never done this on video before. Find that spot where it's the top of the mound, and then you just open the hand and you'll be right on that spot. So it's important to know that the spot is actually right up against the bone of the index finger here. And again, kind of in the middle. But if you use that little trick, you'll kind of land right there. This is a point that just holding steady pressure is fine. Again, for some people, they just find kind of massaging and working in this whole area here can be really helpful. And so large intestine 4 is a point that can be good for helping support good immune function. It's used a lot for any kind of facial issues. So if we had a frontal headache, sinus congestion, dental pain, this point can be used really for any kind of pain symptoms. It's a very clearing point. So this point combined with a point on the bottom of the foot, which sits similarly between the first and second digit. See if I can get this foot up here. So if we get right between the first and second toe and then come up that web space again until we start to hit the bony area. Those 2 points together are called the 4 gates. And one of the effects of those are, again, helping us with the physical manifestations of stress. So for a lot of us, most of us, when we're really stressed, we really tend to hold into our body. And so the idea is by using this point up here and that point between the first and second toe, it's opening the gates. It's like opening the windows in springtime and kind of like letting fresh energy in, moving out the stagnation, relieving things. So it can be helpful for really releasing some of the physical holding, which just tends to compound our stress. So that can be really helpful in that respect. And then next we have large intestine 11. So if we have our arm bent like this, you can see very clearly the end of the elbow crease. And then this is the bony area. And so large intestine 11 is going to be right in that space between the ends of the crease and that bony area. This is a point that's particularly good for helping with fever. I've used this with my children when they were younger, and oftentimes within just a few minutes of just inserting a needle into that point, the fever would start to come down a few degrees. So it's really good for fever, and it's also good for helping support our immune function. And so there is some research that reflects stimulation of this point, helping stimulate more white blood cells, more blood cells in general, helping support the functioning of that system. I'm going to talk about a couple stomach points. As I already touched upon, the stomach is really in a lot of ways, the source, or in Chinese medicine, it would be called the mother of the lung, the respiratory immune system. And so really helping nourish and support that. Stomach 36 is a very powerful point. I use it for almost everyone because it is such a nourishing point. And that nourishment, obviously, food, water, but also the other levels of nourishment are mental nourishment, our psychological, spiritual nourishment. And so this is really about nourishing ourselves and supporting ourselves. It's a point that has been shown to nourish, again, the immune system, has an effect on blood counts, energy, and also it's a very grounding point, and so it can also be used for helping calm us down when we're feeling a little bit out of control. Here we go. So the way to find this point, this is my right leg, obviously. So I'm on the outside surface of the leg. There's two ways to find this. If we come to the lower corner of the kneecap, there's a little depression there. And if we come basically 3 hand widths down, we're going to be at that point. I oftentimes find that it can be just as easy if we come up here, and we're going to get to a point where it starts to branch out to form the plateau for the knee. And right where that branches off is right where stomach 36 is. So this would be a point certainly to be using very proactively, both for immune system function and to help us kind of calm, settle, ground ourselves. This can also be a great point to put some gentle warmth on to just kind of reinforce and nourish that initial stimulation. I'm going to talk about a couple more points on the lower body. So I might actually change this camera angle a little bit for a minute just to make it a little easier to get my foot up there. Maybe I'll do it like this. Nope. All right, here we go. So I wanted to talk about 2 points. One is spleen 3, which is actually, we have that big joint for the thumb. If we come onto the other side of that joint there, spleen 3, can kind of work there. And then if we just follow along this bone, we'll come to the head of this bone at this end. And again, right in the little nook there, and the soft spot right up against there is spleen 4. So spleen 3, spleen 4. So right on the side of the foot there, those 2 points. These are both really helping support the digestive energy in general, both the spleen and the stomach. So the stomach is where the breaking down of food occurs. And then in Asian medicine, the spleen is where the essence of the food, the drink, the things that we consume in our body are taken in and then transformed and transported to the rest of the body to do what they need to do. So those 2 points together can be really helpful for helping the gut function well, to therefore support the immune function as well. And these points on the lower body, a lot of them also have a calming influence. So this would, those areas particularly that I really find that kind of dragging along between, on the foot, between those 2 spots can be a great way you're getting both of those and kind of reinforcing that effect. Another point I like to use on the lower body for kind of really helpful for sleep, calming, settling, is if we find that ankle bone on the inside of our leg. There we go. We get right on that tip and we go 3 fingers over. We get our finger, and again, we're right against the bone, but we're not on the bone. We're right behind the bone. This point is a very powerful point. It's a point where The spleen, liver, and kidney meridians all cross. And so there's some support there across the board. But for our purposes today, the main thing I wanted to talk about with that would be its grounding, kind of calming and settling effect. And I'm going to do one more on the feet, and then we'll go back up to the upper body. So the last one would be, again, on the inside of the foot. So we had spleen 6 right here, and then we have kidney 3 right behind that. So if we, again, find the tip of that malleoli, the ankle bone, and we come back to right in front of the Achilles tendon, we're going to, again, be in a good depression there right behind there. This is, both spleen 6 and kidney 3 are really nourishing of the yin, the fluids of the body, which are really important. But spleen 6 and kidney 3 together can be really helpful for calming and settling the system, helping with anxiety, helping with sleep, help in general with those types of concerns for our purposes today. All right, get to talk about some easier points again, where I can just sit here and show you a little more easily. So the next point I want to talk about is heart 7. Heart 7 again. So we had lung 9 over here. Now we're going to talk about heart 7. So heart 7 likewise is right on that wrist crease. There's a tendon for the little pinky finger there, and we want to be right inside of that. Again, in a softer spot between the tendons and the bones of the wrist there. Heart 7 is a really good point for helping calm the mind, calm the spirit. I've had a lot of success over the years with having people use this as an acupressure point in a moment where they're feeling the anxiety really starting to build, either kind of uprising or feeling it in their chest already. I've had a lot of people find that if they wake up during the night and if they can do some breathing and just kind of hold this point while they're trying to kind of settle back in, people feel that it helps them kind of get back to a better place and be able to get back to sleep a little bit more easily. And then we have a couple more points on the wrist. So we have pericardium 6 and 7. And so this, for these, what I usually encourage is more of, again, kind of more of a stroke, where you're right in the center of the wrist. You get off of that harder ligament, the carpal band there. So you kind of, if you're relaxed, you can kind of feel where it's harder, and then you get to about here. And then you can just kind of work along this area between here. This point in particular can be really helpful. Both of them can be, but really helpful for helping manage nausea, vomiting, any kind of where things are trying to come up that should be going down can be really helpful. And along those lines, oftentimes when we are feeling more worked up or anxious, there's a lot of energy coming up, and these points can really kind of help bring that back down. So they're good for the digestive function. They're also good for calming. Similarly, on the back of the arm, in between the two bones, we have a couple triple warmer points. So the triple warmer refers to the idea of there being 3 distinct regions of the trunk of the body, and the upper, of course, being respiratory and heart, the middle being digestive organs, and the lower being reproductive and elimination organs. For our purposes today, again, we're going to kind of get off that carpal band in the softer area, and you can kind of just work a couple inches along here, and you're going to be hitting a couple points. These are points that have also been shown to have a positive effect on overall immune function. This meridian energetic pathway also goes up and around the ear, so it's often used in particular symptomatically for a lot of ear-related issues, ear infections, ear congestion, other auditory concerns that these points can be used for. I am talking about them mostly today for their effect on helping support the immune function. And then lastly, we have triple warmer 10. So if we get off the bony area, again, come off this hard area. And we're right, so here's the tip, and we're in a straight line right off of there. And that is a point that, along with this large intestine point that I talked about before, can be helpful for an acute infection. So good for reducing infection, reducing fever, reducing some of the symptoms that kind of go along with being sick. I'm going to talk about a couple of points just on the back of the head. These are more for, again, stress management and an area where a lot of us hold our tension. So if we are on the side of our neck and follow that up to the scalp, again, we're going to be in a little depression right up against between the muscle and the bottom part of the scalp there. This can be a really good point for relieving tension all through the neck and through this area. Has a nice descending action, so if we're feeling a lot of this, can kind of help bring it down. Can be really helpful for headache, and again, releasing some of that muscular tension. And then likewise, we have another gallbladder point 21, which is about halfway in between the neck and the shoulder. Most of us, if we start prodding around in there, there will be at least a little bit of a knot, if not a big one. It is an area where a lot of tension is held. And this is a point that, again, can kind of release a lot of that physical holding and manifestation of stress and help just kind of like, from this, kind of help bring this down like this. It does have a pretty strong descending action, so it's one of the few points that is actually contraindicated, actually large intestine 4 being the other one. Not good points to really be stimulating during pregnancy, for example, because they're pushing things down more than we might want them to. All right, so next I'm going to talk just about a couple liver points. So one that I really like, and which again I find particularly helpful when we're holding a lot of stress more in the middle of our body, more in our gut. So if we find the bottom of our rib cage, so there's going to be that lower angle of the rib cage. We're going to be right off of that. And there's also a gallbladder point right along here. These both are really good for, kind of as we're talking about the gallbladder points here, the liver moving stagnation and stuckness and holding in the middle. One of the things I oftentimes encourage people to do for this is find that spot and then just using your hands, you're basically just using the back of your hand and you're just brushing down, brushing that off. And a lot of times you can feel almost an immediate response of things kind of opening up and loosening a little bit in the center there. Yeah, right. So there are two other meridians, one on the front of the body, one on the back of the body. The front one is the Ren or conception vessel, and the back being the due or governing vessel. So we already talked about this Ren 17 point. And then there's also a spot just about a hand width below your navel, right on the midline. And this is a kidney point. And the kidney system in Asian medicine is really the foundation. It's the first system that develops, and it's really responsible for kind of our constitutional strength, our immunity, our energy. And it's basically the mother of all. So this particular point in the lower abdomen, and again, what I would recommend is just using a couple fingers and kind of working that area right on the midline between the navel and the pubic bone. There's several points that can be helpful there, particularly that Ren 4 point, which is one of the creases in the musculature down there, if you're trying to find it, can be really helpful. And then the due or governing meridian on the back, there is a point right at the crown of the head, due 20, which can be really helpful for kind of like calming the mind, but also focusing the mind. So it's actually a point that can be used to increase mental energy, but it's a nice calm centered energy. So for example, do 20 as well as a set of points called Xishan Kong around that point have been shown and being used in a lot of ADD protocols, for example, can be used when when we're stressed and anxious and our mind is going everywhere. We can kind of hold some pressure. This is one of the spots that I like to do, a very gentle tapping all around the crown of the head. And this can kind of bring us some clarity, some focus, kind of bring things, calm things down a little bit within our mind. There's a couple other points that I'll just mention. One is basically if we go to the level of the upper corner of our scapula, and we come right across to the back there. There's a couple spots there. So there's a spot there, and then if we go a little bit lateral and actually right at the corner of the upper corner of the scapula, both of those points there can also be really helpful for supporting immune function overall. So those are good proactive points for immune function. And then in the small of the back, the low back, is the kidney area, again, really good for helping give us just general support, including immune support, energy support. And one of the things I like to do there is just kind of gently kind of working in that area, as well as just kind of putting some stimulation right in that area, right at the lower lumbar curve there. So right next to the dew, which follows right along the spinal cord, we have the urinary bladder meridian. And wasn't going to talk a lot about that, other than there was that one point that I mentioned right next to the corner of the upper corner of the scapula. And then likewise, right at the small of the back and that lowest part of the curve of the lower back, if we just come out into the paraspinals, that muscle ridge on either side of the spine, that's also another kidney point. So those 2 points together can be really helpful for supporting our immune system, as well as just our overall energy and strength. Another thing that I've found to be really helpful over time for people would, along those lines, is using the bladder meridian. So I mentioned that those spots are along the paraspinals, which is the muscles that run on either side of the spine all the way down. So if we just take a finger on either side and just start right at the neck and work our way all the way down to the waistline and do several repetitions of that. Obviously, that's not something we could do ourselves, but if we have somebody to do that with, that can have a really calming influence and can be really helpful, particularly before sleep. We use this a lot in pediatrics, both as an OT and as an acupuncturist. I found it to be really helpful. So you can use fingers or you can use like a brushing motion. One thing in particular is, so basically you're stimulating the paraspinal nerves as they're coming out of the spinal cord. You always want to be going down for calming. For those people that might need a little bit of a perk up, you can actually do the opposite and do a little bit upward movement. That's going to have the opposite effects. But if we're really looking at kind of calming the system, helping with sleep, we just do several strokes down again with some good pressure, but you're not digging in, but you're definitely getting a little indent into the skin as you're pushing down. Again, that would be something that you could certainly use a tool like this and just kind of come down along. So that's about it. There's one or two other points. So there's a point right in between the brow, the third eye area. And this can be another point to kind of help us bring our focus in, kind of calm and ground us. And it's basically right between the two brows. So for most of us, you're going to feel where that orbit of the eye stops, and then there's a little depression here before we get to the other orbit of the eye. And it's right in that space in between. This is a spot, again, I a lot of times prefer, if I'm going to do something with it, is kind of more that pinching, where I'm kind of holding it and kind of pulling up the skin a little bit. And this can be really kind of calming and organizing as well. So I hope everyone found this helpful. I hope that you have an opportunity to practice. As I mentioned before, I gave my email address out. If you have any questions or need any clarifications, or would like some of those index cards for some of the points so that you have another visual reference, just email me, let me know. I'd be happy to provide those. Um, I do encourage people to kind of be patient with themselves, as it's something that at first you can feel like so uncertain, and the more you do it, you start to get a feel for it. You start to get a feel for where those spots are. And it can be really a helpful tool, even doing it a couple times a day, and certainly something to try and share with other people as well if you find it helpful. I think it's a really nice self-care strategy. So just try and spend some time with it on a regular basis. Be patient with yourself. If you're having questions or problems, either being able to just do it in general or with a specific point, I'd be happy to answer any questions. I wish you all well, and I'll look forward to speaking with you again next week.